point, let's take some time to understand where we are at in terms of research and what more can be done going forward for the rare disorders space. Now, joining us on set, we have Dr. Zipporah Bukania, who is the Deputy Director, Kenya Medical Research Institute, KEMRI, in charge of the Center for Public Health Research. Joining us virtually, we are joined by Professor Adrian Fisher, who is a principal investigator at Camera Reed and at the University of Cambridge and Cambridge Africa representative. Thank you all for being part of this conversation. And I'll start off with you, Professor Fisher. You recently founded the Camera Ed program to advocate for families who live with rare diseases. Why an interest in the rare disease space?
Well, thank you very much for organising the session this morning, and I've really been enjoying many of the stories. And I mean, mine is a academic and a personal link. I mean, I've been very excited by all of the changes that have been happening around the rare disease community, and beginning to understand now there's a real challenge across the whole world. And as a parent, you know, I have also quite a strong interest and a lot of experience, really, as a parent of 4 children, only one of whom has rare disease, my youngest child, and seeing him grow and face the challenges that all of us are very familiar with in the community. It's lovely to see a child flourish despite the many challenges that come along with having a rare disease. And so we founded this educational program, really, to try and start to highlight some of the challenges that most of us will be aware of as part of this forum, but also to try and bring forward the positives. You know, it's not just about survival. We understand the survival rates. We understand all the difficulties around that. Of course, we can't underestimate that. But life is about not more than survival. It's about living, and it's about having, you know, experiencing within our own selves. So that's really what the education program is about, and that allowed us to connect with many organisations, including RDK, who have been brilliant, and that's led on to some projects which we've been very fortunate to be funded through Cambridge Africa, an organisation that's part of the University of Cambridge, which is linked into KEMRI and the Rare Disorders Kenya.
Okay, and even as we understand now that you're a caregiver to a child living with a rare disease, we've been talking about the world over, especially in the rare disease space, celebrating this UN resolution that recognizes these communities around the world. What does that mean for you?
I mean, I think as the public health minister was talking about earlier, I mean, at the end of the day, to an individual, UN resolution it sounds great, but it's maybe not a practical day-to-day thing. But I think at a government level and an international level, it's absolutely critical to get each organisation to start to align and understand the challenges that all of us report as individuals. But as individuals, we can't influence policy, you know, directly. It does really need those high-level UN resolutions. So it's absolutely critical. And with a resolution comes strategy, comes policy. And that filters down then through all the different communities throughout the systems. It's not just the hospital systems, it's the social systems, it's all these aspects. It's even just integration in education as well. You know. So the UN resolution is absolutely critical. It's a starting point. It's the end. But with a resolution comes alignment, and governments then try and align to those resolutions, and generally that means that they need to fund things. And money is always a part of this equation. We do need funding in this sector. I mean, 5% of rare diseases have treatment, and that's not a cure even, that's just a treatment. You know, 95% of people are just, you know, it's just brute force. There's nothing else that you can do other than use your life energy to try and deal with things, and that just isn't, you know, that isn't what it should be. And so the UN resolutions will gradually filter down into that funding of new treatments, and we've seen with COVID that actually it is possible to develop treatments and strategies that allow people to begin to live again as they knew before. So healthcare and the strategies to develop treatments these days are much more advanced, and that gives us hope. I mean, it's not immediate, but it definitely gives us hope.
Now, speaking about strategies and hope at the end of the tunnel, I just want to understand from you, Zipporah, you have been in the nutrition space for a while now, but now involved in the research of rare diseases. Why?
Rare disease is one of those things that people really don't talk about. And I think from what we have heard, even from the caregivers of patients with or persons living with rare diseases, there isn't much that is available for them out there. Now, one of the reasons that I felt that participating in studies around rare diseases is important is because in every rare disease, in most circumstances, there'll be challenges with feeding, there'll be challenges with the nutritional uptake of nutrients from the foods they absorb.
And speaking about interventions, how is that going for you so far?
So I think one of the things we have to take note of is that we haven't had a lot of activities in terms of research with rare diseases. So I wouldn't want to say that probably we are doing a first one. There could be people who have done something, in the sphere of just finding out issues around rare disease. So we are doing our first sort of stock taking. First of all, to understand the challenges that persons living with rare diseases are facing. And these challenges will range from not only nutrition, because nutrition is just a part of, the main issues they may have, but we do realize that if they have a challenge in accessing, for example, treatment, it also means that there is expense in terms of, the cost of treatment, seeking healthcare support. What is left for the family in terms of, supporting nutritional intake? So the idea that we have right now is sort of a pilot, and that's why we've partnered with Adrian from Cambridge, just to first of all give an understanding of within the sphere of the current rare disease disorders network, to understand what are the key things we probably need to focus on. Because with research, you can research on anything, but we need to research on something that will be useful in terms of interventions. So we can't go in blindly. We need to have, first of all, what is this gap that we need to look at?
Now, Dr. Fisher, you mentioned definitely the strides that are being made in the research sector in as far as rare diseases are concerned. And I'm just curious, with an eye both in the UK and Africa, in your capacity at the University of Cambridge, what are the similarities and differences we have in the two regions when it comes to the research of rare diseases?
I think if you just talk globally, there are three very key things which we all have challenge with. First is diagnosis. It's exceedingly difficult to actually diagnose a rare disease in many cases because the clinicians will maybe never have come across a child with a particular condition. I mean, my child is one of 60 children in the world that has a particular condition. Every clinician we meet has not met this experience, and there's no visible, not a visible disability in inverted commas. It's not something that you can see. So the diagnosis actually is very difficult, and diagnosis is critical to the management and the treatment of a child or an individual. So, for example, our child was diagnosed when he was 8 years old, but he had to join a genetic screening program. These amazing programs which have been enabled through research and current technologies that allow us to take a very simple sample of saliva from you, takes a couple of seconds, and your children, and we can scan this, and people can now read the genetic information. It's important to diagnose. So diagnosis is one of the critical things, and it's moving forward. Of course, diagnosis only gives you a bit of information about the child, and of course, there's very limited data. If there's only 60 children in the world with a condition, the amount of data that's available about that condition is limited, and so the diagnosis will also allow us to help build up data about all the separate conditions, which then means the clinicians and everyone's involved in the management and support of that individual with the rare disease will have more information available. So we have diagnosis data, and then the other challenge is treatment. The treatments are really, they're not there. And of course, they kind of follow from the data. So all these things are mapped together. Every country has those same challenges. I think in terms of the difference between UK and Kenya, from my experience, I mean, we're all very much in the same boat to a great extent, I think. there's a little bit more data and more definitions of what rare diseases are in Europe and perhaps in the US than we've come across in our experiences in Africa generally. And that's one of the things we're advocating as part of this research program, that we need a registry, which was touched on already from the ministry earlier, and that we need ministry involvement. And again, that's been fantastic, really rapid response from this program and others, of course. So that's a general comment about rare diseases across the world, but also some slight subtleties and difference between information available perhaps in the UK and Europe and what's currently available in Africa generally and in Kenya. And of course, organisations like RDK that are advocating and being very open about their own experiences, bringing day-to-day experiences of life for individuals, will have a big impact in how that is then pushed forward in the individual countries. So that's these advocacy groups are absolutely critical, and days like this are very important to bring information to the general community. So many people don't know about rare diseases. In the UK, they had a survey which said only about 1 in 10 people had an understanding of what a rare disease is. So it's this mixture of things that has to come forward for people to be able to then respond and say that we don't think this is right and we need to do something.
And speaking of which, I have been asking this question and I'll keep asking it. We are in a pandemic and we have seen miracles happen when it comes to the healthcare space in trying to find a solution, in this case, the vaccine for COVID-19. And it has happened in record time. When you think about the lessons learned there, how can those translate in this space of RD?
Priority, we have seen COVID given a priority we haven't seen in a long time, right across the globe. Why was it given priority? It hit so hard, and it did not separate anybody. I don't think rare diseases have separated anybody. We have it across the globe, across economic status. And so it is a matter of these people with rare diseases are actually suffering, and they need to be supported. Can we give it as a priority? It is now picked up by the NCD department at the Ministry of Health. That already is a sign that the ministry is recognizing that rare diseases should be given as much priority as any other NCD. So what it is that other relevant stakeholders can come in and support. We've heard here, from even the caretakers, that treatment is super expensive. Why is it expensive? It's because when you have a rare condition, there is less research that's going around that. When there's less research, you have less knowledge available. And when the knowledge is not available, then not much is also put into creating interventions for it. All right? So we have to find that space where can we create an environment that allows research to happen around rare diseases? We need pharmacy or pharmaceutical industry to come in and understand that the medication for rare diseases is just as important as any other disease. If a drug or a dose of treatment is going to cost, say, 200,000 per dose, how many Kenyans would afford that? What can be done to try and address that? So yeah, there has to just be commitment to that effect.
Now, Professor Fisher, just to follow up on that, as I mentioned, approximately 50% of rare diseases do not have a disease-specific foundation supporting or researching on them. How can we turn this tide?
Well, I think that's a very difficult question to answer, but I think it really comes from this idea that we should be treated equally. That those with rare diseases should have equality of access to treatments. Just because it's rare doesn't mean it's not something that should be treated, and that's the message that comes back through the UN resolution, and it comes back through these advocacies and trying to highlight the challenges around the fact that there's so many rare diseases, and essentially there's just a gap. There's a gap in the system which doesn't really allow treatments to be developed because of the financial aspects and things like this. So it's really getting that established at the ministry level, at government level, that these individuals have the right to treatment. Just because there aren't many individuals with that disease doesn't mean that disease is any less more important than another. And that's a big message that has to come through. It's not that we can't develop treatments. It is a prioritization, as we were just hearing. How do you balance the needs of everyone against those of perhaps have a disease which is not common? And it's a gap. I mean, essentially, there's a business model out there which allows people to get treatments for very specific, illnesses and things like this, based on the ability for the pharma companies to be able to run a business. They have to have a business model. It costs a lot of money to develop drugs, and they do amazing jobs. And the business model, if you like, it doesn't work for small scale. For small elements of society that have a particular disease. So that's where policy and governments need to come in and try and ensure that there is a prioritisation, whether it's through incentivization for the pharma companies to be given support or tax, breaks or whatever it is, to allow them to be able to work on drugs that would not necessarily make financial sense for them, and they have employees and all these things that are there to ensure that they develop drugs for many other conditions. So that's the challenge, I think. It's that equality of access to treatments, and how do you get in place something that allows that to happen.
Now, even as we bring this to a close, in the face of a pandemic, Sub-Saharan Africa has been encouraged to strengthen its capacity for clinical research with partnerships and networks. This has been said to be very key moving forward. So is there support so far as what it is that you're doing, especially when you talk about the nutritional aspect of it when it comes to rare diseases? And what more do you need?
Now, support. So research is very interesting in the sense that a number of times scientists actually resource for funding from different stakeholders, including government. So what matters is, what priority is it to the government? Are we putting it forward and saying, as government, let's put resources into this matter and we need to find answers now? Besides that, we also have networks that we work with. For example, KEMRI is now working with Cambridge University, and that is how we are in this space right now. Of course, the funding is never sufficient for research, but we must learn how to prioritize, all right? So for us, I think what will move this space in research forward is really just about the funding support, irrespective of where it's coming from. We would love government to give more support, because then we'll also sort of, own this process in a better way and address the problems that are actually Kenyans are, encountering. Suffice to say that we cannot do without our partners as well, because one, they don't come in just with the funds, but they also come in with the technical capacity that gives us the leeway to understand what other countries have done. We learn from them and we pick up lessons from that. So funding is if funding is available, you can research on anything. Gladys, I can sit here and look at you the whole day and I'll write a story about you just by seeing how you behave the whole day. So research is one of those things where it just depends on the scope you want to cover. It depends on the resources that you have. And because resources are not sufficient, we must prioritize. For example, right now we'd like to know, what is it that persons living with rare diseases, what challenges do they have when it comes to accessing healthcare? Because that is a starting point. We have signed up as a country for universal health coverage. Are we covering for everybody? Are we considered that they have special needs, that even just accessing a health facility is one of those things we need to make sure happens? I might have the resources as a person living with rare diseases, but I need a special device to move me from my house to the health facility. Probably when I get to the health facility, I need access to probably oxygen, for the period I'm in the hospital. Is that available? So we have to look at that from that perspective. If we are leaving no one behind in all this plan, then we can't leave people with rare diseases behind. Again, we also are signatories to many other, initiatives. Agenda 2063 has put aspiration number 1, actually looks at the health and well-being of individuals. We signed to it as a country, so we must put this theme as part of the well-being of every Kenyan that needs to access healthcare and the well-being. Look at the Constitution. What does Chapter 4 say? It's all about healthcare. We must be able to access healthcare. A number of people who are suffering from rare diseases, actually children. And that is a very fundamental right in terms of, can we make their life as simple but also as normal as possible, given the circumstances they may be living in.
Very well said. And we'll be hearing more from you in a moment. That is definitely on about research and the importance of it in the rare disease space. Dr. Zipporah Bukania, Deputy Director, Kenya Medical Research Institute, KEMRI, in charge of the Center for Public Health Research. And joining us virtually was Professor Adrian Fisher, Principal Investigator at Canberra Reid this is at the University of Cambridge, and Cambridge Africa representative. Thank you for your time. Now, at this point, let's also take in a video when it comes to advocacy and patient empowerment of those living with rare diseases. It has been said over and over again, it is so important that we keep raising awareness around rare diseases, and the best way to do so is actually for those that are living this reality to come out and speak about their reality. Some might be shy, some might be very concerned about the stigma and isolation that comes with living this reality. But the truth of the matter is, when you come out and speak about it, it shuns this stigma, and because we are giving or creating information and, of course, awareness.